Let's talk about otitis media, a condition you'll see often, especially in kids. It's simply inflammation or infection of the middle ear. Understanding it is key for anyone working in healthcare. The middle ear is a small air-filled space behind the eardrum, containing 3 tiny bones crucial for hearing. It connects to the back of the throat via the eustachian-tube, which equalizes pressure and drains fluid. When the eustachian-tube is blocked by swelling or infection, fluid gets trapped, creating a perfect environment for germs. This is why colds often lead to ear infections, inflammation spreads, the tube swells shut, and otitis media develops. Otitis means ear inflammation, and media refers to the middle ear. Otitis media isn't just one illness, it's a group of conditions affecting this area. Knowing the anatomy and function of the eustachian tube helps us understand why ear infections happen and how to treat them. Think of the middle ear as a room with a single drainage pipe. If it's blocked, problems start. That's why understanding the ear's structure is essential for diagnosis and management. Recognizing these basics sets the stage for effective care. There are 4 main types of otitis media, each with unique features. Acute otitis media, AOM, is the classic ear infection, sudden pain, fever, and a red bulging eardrum. Otitis media with effusion, OME, or glue ear, involves thick fluid in the middle ear without infection, mainly causing hearing issues. Chronic suppurative otitis media, CSOM, is a long-term infection with a persistent perforated eardrum and ongoing ear discharge, often painless but leading to hearing loss. Adhesive otitis media is a severe chronic form where the eardrum retracts and sticks to the middle ear bones, causing permanent hearing loss. Each type requires a different approach, so distinguishing them is crucial. Acute infections need prompt attention, while chronic forms focus on long-term management. OME can impact speech in kids, so early recognition matters. CSOM and adhesive types can cause lasting damage if untreated. Understanding these types guides our treatment decisions. Proper identification ensures the best outcomes for patients. Otitis media usually starts with eustachian tube dysfunction, often triggered by a cold. Swelling blocks drainage, trapping fluid and germs in the middle ear. Common bacteria include Streptococcus pneumonia, Haemophilus influenzae, and Moraxella catarrhalis. Viruses can also play a role. Young children are most at risk due to their anatomy and developing immune systems. Daycare attendance, tobacco smoke exposure, allergies, and lack of breastfeeding increase risk. Recognizing these factors helps us prevent and manage infections. Prevention advice is as important as treatment. Understanding the causes helps guide both care and education. Symptoms depend on the type of otitis media. Acute otitis media causes sudden ear pain, fever, irritability, and sometimes vomiting, especially after a cold. OME is quieter hearing loss, fullness, or speech delay, but little pain or fever. CSOM presents as a painless, persistent ear discharge and significant hearing loss. Diagnosis relies on history and otoscopic exam. Look for a red bulging eardrum in AOM, fluid or retraction in OME, and perforation with discharge in CSOM. Tympanometry can help confirm fluid in the ear. Early recognition prevents complications. Regular hearing checks are vital for at-risk children. Accurate diagnosis guides effective treatment. Spotting the signs early makes a big difference. Treatment depends on the type and severity. For AOM, watchful waiting is often best. Pain relief first, antibiotics only if symptoms persist or worsen. OME usually resolves on its own. Monitor hearing. Refer to ENT if it lasts over 3 months or affects development. CSOM requires ear cleaning and antibiotic drops. Surgery may be needed for persistent cases. Prevention is key. Vaccinate, promote breastfeeding, avoid tobacco smoke. Address allergies and other risk factors to reduce recurrence. Educate families on signs to watch for and when to seek help. Early intervention prevents long-term problems. Tailored management ensures the best outcomes. Good prevention and timely care make all the difference.